Let's talk about tattoos and potential health risks of tattoo ink, particularly risk for cancer. Now, I think this is relevant because a large percentage of the population now has at least one tattoo. And if tattoo ink is associated with increased cancer risk, that's potentially a big public health issue. And so determining that would help promote or lead to probably changes in the types of inks that are used and further studies into the inks to determine, which inks and which ink ingredients are raising risk for people. So this study is looking at twins from Danish culture to compare tattooed twins versus non-tattooed twins and occurrence of cancer, specifically skin cancers and lymphoma, and see is there an increased risk of cancer associated with being tattooed. And it's important to do this. And I posted about this study last week on social media, and a guy commented saying, this is a, low quality study and blah, 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 this is crap and you shouldn't scare people and all that. And it's like, I'm not scaring people. This is the information we have. And the point is you have to start somewhere with the research. And so you start with something with epidemiologic research like this, which cannot show a causal link, but what it's doing is looking for correlation or association. And yes, correlation is not causation, but if it's strong enough, that then triggers researchers to design more in-depth studies that have stronger statistics and, can show causal connections. And over time, we get the answer we're looking for, or we get the answer that, hey, it's not connected. These authors said this is the fourth study that they know of that's even looked at this question. So this is a very under investigated field. And again, we have to start somewhere. So this is where they started. And these authors, again, want to compare twins to look at tattoo risk with cancers. So let's get a little background to set it up. These authors state the overall proportion of people with tattoos is up to 25% in some countries and nearly twice as high among younger generations. I often comment to my wife when we're at the pool or the beach and say, we might be the only couple, here that doesn't have a tattoo between us. So they're that common, at least, at the pools and watering holes that we go to. With the increased popularity of tattoos, safety regarding tattooing and exposure to tattoo ink becomes increasingly relevant, and the lack of studies based on population data to assess carcinogenicity is of particular concern. So again, these authors are saying tattoos are everywhere and there's been no research investigating health risks. So we need to start that ball rolling. Particles from tattoo ink have been found to accumulate in regional lymph nodes, and they may be transported through the blood to other organs. It is an open question whether they could cause harm in the skin, to the immune system, and even to internal organs. The most frequently used tattoo ink is black. Black ink typically contains soot products like carbon black, which is listed as possibly carcinogenic to humans by the International Agency of Research on Cancer. Now, they have studied it via inhalation, not through, being placed in the skin via tattoo ink, but there is precedent for it being carcinogenic in some capacity. Through the incomplete combustion used for carbon black production, polycyclic aromatic hydrocarbons are formed as bioproducts. One of the most dangerous of these is benzoapyrene, which is classified as carcinogenic to humans, again, by the International Agency for Research on Cancer. Another hazardous substance found in colored inks is azo compounds, and these might release carcinogenic aromatic amines following exposure to sunlight or laser treatment tattoo removal. On a more general level, red ink has been observed as the most predominantly used color among patients with allergic reactions. So again, there's precedence for it being unhealthy for at least some people, so we want to investigate that and know so we can give informed consent and make healthy decisions. The authors state, to the best of our knowledge, there are only 3 published studies seeking to obtain empirical evidence regarding the potential link between tattoo ink and increased risk of cancer. 3 studies is not a lot. So again, we need to build the data there. Thus, there's a deficiency in existing literature, and they want to help close that gap. We conjecture that tattoo ink induces inflammation at the deposit site that may eventually lead to chronic inflammation and increased risk of abnormal cell growth, especially skin cancer and lymphoma. We emphasize that this may happen for any type of ink due to foreign body immunologic response. In addition, ink particles with known or suspected carcinogenic properties may gradually increase the risk over time. So again, anytime we put something foreign in our body, the immune system is going to respond to that, right? Whether that's tattoo ink, a new novel creation like a mRNA vaccine, or a breast implant, or any number of these things. That's a foreign body in our body that the immune system doesn't recognize. That promotes an immune response and potentially inflammation. If it drives chronic inflammation, that can drive cancer. In the case of breast implants and other foreign objects, you can have what's called haptenization, where the breast tissue meets the foreign implant. Sometimes the immune system will create an antibody that recognizes Frankenstein protein, basically, which is part one side of the border of the breast tissue, the other side of the border of the implant. And now you've got the side of the border that is the female's breast tissue. Now you have the immune system recognizing self, and that can drive autoimmunity. So we want to know about this stuff. So in this study, they took pairs of twins, and for pairs in which one twin had been diagnosed with cancer and the other had not, they wanted to investigate which of the twins had been exposed to tattoo ink, as this approach might provide tentative insights into the processes governing ink exposures and cancer development, which are expected to occur over a long duration. Inclusion criteria in the case co-twin study was 1, at least one twin was diagnosed with one or more of the following cancers: Hodgkin or non-Hodgkin lymphoma, or skin cancer, melanoma, non-melanoma, excluding basal cell carcinoma, and or bladder urinary tract cancer. So they followed these twins via survey over time to find out, hey, what were the odds of the cancer occurring? And so if we look down here at the discussion, we can see in the case control study, the hazard ratio of skin cancer was 1.62 times higher among tattooed than non-tattooed participants. So the way that hazard ratios work is that a hazard ratio of 1.0 means you have an equal risk of the outcome that you're studying as opposed to the next guy. So if we're studying risk of skin cancer, a hazard ratio of 1.0 means you have no increased risk. If you had a hazard ratio of 0.8, you'd have a 20% reduced risk compared to the other person over time. Or if you have a 1.62, it means you have a 62% increased risk of developing skin cancer over time. So the findings in the case control arm of this study found that tattooed twins had a 62% increased risk of a skin cancer diagnosis compared to non-tattooed twins. The twin matched analysis for 14 twin pairs, discordant for tattoo ink exposure, meaning one had it, one didn't. And skin cancer shows a 33% increased risk. For both skin cancer and lymphoma, increased hazards were found for tattoos that are larger than the palm of your hand. Okay, so skin cancer was 137% increased risk for tattoos larger than the palm of your hand. Lymphoma, 173% increased risk. Quite significant increased risk associations here. Again, that does not equal causation. These are associations that they're finding, but they're large enough in my mind to suggest that further research should be done to test with methodologies that can establish causality. Our findings are consistent with the conjecture and with reported findings such as squamous cell carcinoma, benign tumors, lymphoid conditions, and rare cases of malignant neoplasms occurring within the area of a tattoo. So again, there's enough the findings here suggest we need to look further. All right, what are some weaknesses of the study? Well, first, there are several different types of tattoos. The intended focus of this study was on classic decorative tattoos. So, when someone says tattoo, that's what they were interested in. But there's also, there's permanent makeup tattoos and there's medical tattoos. And since this was a survey-based study, people with those may have answered. And, the researchers don't know, they didn't differentiate in the survey, is this a classic decorative tattoo or a medical tattoo or permanent makeup? So that's how they could do better next time and focus only on the decorative tattoos. They did not ask about sun exposure here. And so that lack of information is a study limitation because, perhaps skin cancer was due to sun exposure in some of the people, unhealthy sun exposure. As they say in the following paragraph, association between tattoo ink exposure and skin cancer outcome may be the result of later detection due to abnormalities being concealed by the ink. In other words, tattoo ink may not cause cancer, but quote unquote merely lead to later detection and thus potentially be associated with more severe stages of skin cancer. This is something we plan to delve deeper into in future studies. And then additionally, having a tattoo, especially among adolescents, has been suggested as an indicator of risky lifestyle behaviors like smoking and alcohol consumption, both risk factors of certain cancer types. Hence, evidence of an association between tattoo ink exposure and occurrence of cancer may be confounded or blurred by other health-related lifestyle factors. So again, future studies will have to control for those confounding factors like alcohol, smoking, etc. There are other concerns related to long-term safety of tattooing that remain to be studied. With the increasing popularity of getting tattooed, it is necessary to question the safety of laser tattoo removal, where pigments are broken into smaller fragments that leave the site of the tattoo. The question is, where do the pigment fragments end up? Decreasing particle size often allows for greater migration potential. This is also an issue in relation to decomposition of ink particles induced by sunlight or sun radiation. Besides, with ink particles traveling through the blood, could tattooing during pregnancy or the following period of breastfeeding be injurious to the offspring? Furthermore, on the more speculative side, we suggest research into ink compositions that can be dissolved or investigations into medical treatments that can remove some of the persistent chemicals from the body, especially the lymphatic system. So again, this is early on in the research on tattoos and health outcomes. And I think these researchers did a great job doing what they could do with the methodology that they chose. And they listed out multiple areas where future studies could do better and be more specific. And in so doing, increase the overall knowledge base for us. So I think this was not a waste. I think this was right in line with where they should be, given it's only the fourth study ever run on this topic. And as the information increases, researchers will be more interested, hopefully, and will get more information out there. So in conclusion, our study points toward increased hazard of lymphoma and skin cancers among tattooed individuals. So until we have, further studies drawing causal relationships or disproving causal relationships, this at least can give us an idea of, okay, let's, if we're creating an informed consent about getting a tattoo, informed consent is benefits, risks, and alternatives. So under risks, say, we could list, hey, there is some data suggesting an association between the tattoo ink and skin cancer risk and lymphoma risk. So do you have a family history of skin cancer or lymphoma? You might want to reconsider the tattoo if you do, right? Or maybe you don't need a tattoo that's the size of your entire back. Maybe you get a tattoo smaller than your palm, and maybe that means there's decreased risk over time. But I think it's something, because of how popular it is, it's something that needs to be investigated further and considered on an individual basis. So let's open this up.
Thank you for bringing this to our attention, because it's not something that I ever thought about.
Yeah, you're welcome. It's It clearly by the lack of papers, it's not something a lot of people have thought about. But again, based on the number of people that have them, I think it's something that should be. We read labels on our foods and our drinks, um, and those go in and then leave us. So I think, if something so transient should be so investigated so thoroughly, then why not something that's going to be on you forever? We should be reading
Yeah,
labels on the tattoo ink, right?
I would definitely agree. Just not something I thought about before.
Well, I tattooed my eyebrows many years ago, and I wanted to have them done again, but now I'm not sure.
Yeah, so that would fall under the permanent makeup side that they were talking about.
Right.
Um, but I don't know. I don't know if they use a different ink or again, these are questions we want to ask and have studied further, but I don't know the answer, but I would suspect probably the black ink they're using for eyebrows would be this similar or not, if not the same as what they'd use for other tattoos.
I
I
would
don't
think so
know.
too, because it fade. I mean, all of them fade.
Yeah,
You have to get them redone occasionally.
yeah. And then, the other thing is the what I thought was interesting was the laser removal, potentially could increase carcinogenicity because you're decreasing the particle size and then it travels further in the body. And so my brother's having one removed or part of one removed on his arm. And it's like, okay, well, you think you're doing, well, he's not doing it for health reasons. He's doing it just because he didn't like that part of the tattoo anymore. But um, would it be better if he just left it the way it was? Who knows? So these are interesting questions that hopefully in the next decade we get answers to.